I kind of want to focus in on the level 2 NICUs because I think there's a great opportunity for them to start using high flow nasal cannula and then reduce possible transportations and then escalation to mechanical ventilation, increase family satisfaction to not have to move to a different hospital, and just want to see if that holds water in your experience.
I have nothing to add. It's exactly the right question. One of the biggest, certainly all the things we've been talking about for level 3 utilization hold true. For level 2 nurseries, this absolutely can be a game changer in program development and in census maternal satisfaction. We have, I can give you one example and show you some data on this. This is a level 2 nursery in the periphery of the greater Phoenix metropolitan area, where we started providing the high flow nasal therapy model in September of 2010. You can see that in the years prior to our starting, this is a facility that has about 1,700 deliveries a year, so it's not huge. But even with just 1,700 deliveries a year, prior to the introduction of the aggressive use of high flow nasal therapy, 30 to 40 babies a year were transported out of this hospital into a level 3 nursery. This slide shows that since we implemented the model, the number of transports per year has fallen to about 2 or 3 per year.
Wow.
It's a 20-fold reduction in transports. It's unbelievable. This slide, interestingly enough, just because we looked at the number of vapotherm cases, it basically mirrors the number of transports that used to be sent out. That's why they're staying. Predictably, from a level 2 nursery, a lot of those babies, most of them, were sent for respiratory issues. Not always, and we still transport out some babies. But for routine respiratory support, we do give surfactant in the level 2 nurseries. Of note, we also have in-house 24/7 nurse practitioners in those level 2 nurseries. And so there's good clinical backup for the kids. So that allows us to implement the therapy safely and be more on it. But we again, a 20-fold decrease in transports. That has to catch any administration's eye and any payer's eye in this cost-conscious healthcare evolution that we're all caught in the middle of. Maternal satisfaction, you're exactly right. We're not separating the moms and babies. The OBs are happier. They get to keep moms there and deliver at that community facility instead of sending them out. Level 2 nurseries should be all over vapotherm, and I know I'm a little biased, but we have the data to back it up.
Excellent. And so a lot of the things you talk about are ease of use, and so in a level 2 NICU that may not have full-time neonatologists on staff, I think that ease of use plays a big role. And so I was wondering if you agree and what you have to comment on that.
It does. You know, as opposed to CPAP, which I would be a little bit reluctant to use if there weren't nurse practitioners in-house 24/7. Again, we use CPAP in the level 2 nurseries too, just rarely anymore. But because of the risk of nasal trauma, because of the risk of pneumothoraces and acute respiratory deterioration, we would prefer not to use it. If we can use vapotherm instead, we do. And it is so easy to use that while we do employ a 24/7 in-house model with our advanced care providers, it's because we've chosen to do it that way with proper education. I really want to emphasize that. Definitely. With proper education about how the cannula interfaces to the baby, the mechanisms of action. I think a level 2 nursery with immediate response time from their neonatologists could also safely use this as opposed to CPAP.